Hi, everybody. Welcome to Just a Mommy Minute. I'm using my phone today, so it's going to be, bear with me a second here. So we get a lot of questions in our office because we do see so many moms, pregnant moms, that have breech babies or transverse or posterior. So we get a lot of referrals from area professionals to work on moms like this. So we get a lot of questions. And the number one question is, are you flipping the baby? And so I wanted to clarify that for everybody to kind of talk about what it is exactly that we do. So chiropractors are not OBs. So OBs are the only ones that can do what's called an external version, where they manually turn the baby. What chiropractors are doing, and especially in our office, I do a couple different things. One is what's called the Webster technique, which we do throughout all pregnancy. And it's just a technique to keep the pelvis aligned during pregnancy. And when the pelvis is aligned during pregnancy, so in an ideal world, the pelvis, the bones are aligned up, the muscles are nice and relaxed, the baby innately knows to go head down. When the pelvis is tilted and torqued, the pelvis or the baby has to lay around all that. So all we do is line up the pelvis, work with the muscles, and get the baby in the right position. Okay. So in my training as a pediatric diplomate, we have advanced training in working with babies. So there's more techniques that we do. So I add more techniques than just the Webster technique to try to get the babies to flip. So we use, it's all hands-on, but I want to clarify, we do not actually manually turn the babies. But we have great success with what we do. In fact, over the weekend, we've had 2 babies flip. So the girls usually text me when we get a message from a mom that babies have flipped. And I'm so excited to hear this. Of course, the moms are excited too. And especially when they go in for the external version and they do the ultrasound and find the baby is actually head down. It's a joy. It's one of my favorite things to work on. So hopefully that'll clear things up a little bit. It's all about aligning the pelvis, and it's actually a whole body alignment. It's not just the pelvis. Everything has to be in alignment for the baby to lay head down and hopefully have an easier pregnancy. So my training, my advanced training is, it's called a diplomate in pediatrics. If you're not in the Indianapolis area, there are 3 of us in the state that have this training through the ICA. And if you see letters at the end of the name called DICCP, those are special board certified pediatric chiropractors, and they are trained in doing this technique and others to help with the babies. And if you're in another state, just look for that. And that's the same training that I received. Sorry, it's been a long morning, so I'm a little out of breath from working on patients, but I hope this answered some questions. Bree's asking, how do we know if a baby's posterior? Technically, I don't, but there are some signs. If you have a lot of back pain, that usually means the baby could be laying posterior, but puts a lot of pressure on your back. So when we do work with the mom's pelvis, if a baby's transverse, posterior, anything like that, and we loosen everything up around the pelvis and make a great environment for the baby to lay in, then they should optimally lay the right way. We are trained to ask some questions because there are some things that happen when a mom is pregnant with a breech baby that could be the reason why the baby's breached. Like an anterior placenta could be one, or maybe the cord is in the way, something like that. So there are, reasons a baby could be breached for that. And that's why, you need to be with an OB. And if you're going to actually have the baby turned, you need to have them because you need to be monitored. The baby needs to be monitored. Hope that answers your questions. We've got, I think, a couple more babies that we want to get the mom's pelvis in the perfect position so those babies will cooperate. But we'll keep you posted on this page. We like to celebrate this when the baby's turn for us. Thank you and have an awesome rest of your day.